Hi and welcome to our third video where we go into some more information about teaching on the Year 4 Psychiatry course. So as we saw in the last video, teaching during the student course can be divided up into things that happen weekly and things that happen once each placement. And the weekly activities tend to happen on the teaching day, allocated kind of weekly teaching day that all students will have. So let's talk about CBL. As we mentioned previously, the CBL style of learning is present throughout the MBCHB course at the university from first year to fifth year. This is an example of a case, a patient story, which is used in the CBL in psychiatry. The cases are much longer than this, and this is only the kind of introductory paragraph with questions. There are another couple of pages of this patient's story and questions. But I'll give you a couple of minutes to read that. We'll also share the full case-based learning CBL document with you so you can have a look through all the cases. It's just to give an illustration. So the students would read through the history there, the story, and would think about answering the questions together. The case-based learning structure during the placement focuses on one case each week, and in the current course each case corresponds to, it's kind of a diagnostic focus that corresponds to each of the topics, the diagnostic topics you can see on the right there. So as I mentioned at the heart, I think previously, and you might have got the sense from the idea of students working through material together, is that there is a core shift in case-based learning compared to a lecture-based session or a normal teaching session, which gives the students ownership and control of their learning. So the teacher moves from being a teacher and kind of an expert holder of information to a facilitator of the student's inquiry and learning process. I think in the earlier years, the facilitators aren't necessarily doctors and don't necessarily have more knowledge about the topic than the students, but they are skilled in facilitating discussion and exploration. In the later years, I think from third year on, the teachers also are doctors and kind of have the knowledge as well. So the way it works is that students take the responsibility themselves for the learning. Part of that is nominating a chair to direct the meeting, to help the discussion, and a scribe as well to take notes for the group. So clinical skills sessions usually follow on from the CBL sessions and involve students putting what they've learned in CBL into practice a little bit. Well, that's the intention of it. So in clinical skills sessions, students will usually divide up into small groups, and they will have resources giving a different patient story, patient history, and one of the students will act the part of the patient or try to, and another student will practice acting a doctor in a certain scenario. So there might be, a bit like an OSCE, there might be a scenario that says, take a history from this patient, this is the situation, this is what you have to do, and they would have to act that out, and the third student observes and kind of gives feedback along with their teacher who is observing and giving feedback as well. In some of our areas, professional actors are employed to play the part of patients instead of the students. So this is an example of a patient history and a task that the students might be sort of practicing in these kind of this informal setting, very different to the mock OSCE or the OSCE. And students would usually kind of time limit themselves a little bit for doing these tasks. So this isn't a university mandated teaching session like CBL is across all years, and clinical skills is something that was added to the psychiatry course later. So I just wanted to say as well that there are resources on the kind of university internet page, which is called Blackboard, which the students are asked to read each week before their teaching day, when they will have the case-based learning session and the clinical skills session. So there is a page for each week, and on this page there's a list of resources, which will typically include some textbook reading, watching a recorded short university lecture, and for some of the topics there are EE tutorials as well, and I'll try and get you links to as much of this as I can and link it below. But this is an illustrative kind of image of the resources for the kind of psychosis schizophrenia case. So now I talked about case-based learning, clinical skills, sessions that happen weekly, and kind of pre-reading, pre-work that students are asked to do before that. Just to say, there's a third type of session that happens weekly. It's a bit more difficult to describe because it's not as standardized, and that is the tutorials with the undergraduate tutor. So, not sure if I mentioned previously, but the undergraduate tutor is kind of the person in charge of teaching in the local area. So, for instance, Bath. In Bath, they might have from 5 to 10 students at any one time, and the undergraduate tutor is in charge of supervising them. They're usually the undergraduate tutor is usually a consultant, senior doctor, appointed to the role for 3 years, I think it is. The tutorials are about the undergraduate tutor kind of checking in with the students, seeing how they're doing. So there is a pastoral role, but some tutors run them in different ways. I know a tutor who runs a reflective group, and I know that other tutors will also provide some teaching during tutorials as well. So it does vary a little bit. So let's move on to thinking about the other teaching sessions that are offered. So the introductory lectures, which, as you might guess, happen at the start of the placement. The mock OSCE tends to happen at the end. And the sim sessions, it's actually just one sim session that the students are offered. It's a half day. And that can happen pretty much at any point. So the introductory lectures, these last about 90 minutes each, will happen on the same day. It's usually during the first week of the student's placement, for obvious reasons, and they may be online, maybe in person, depending on the area. And yeah, there's a variable. Sometimes these are taught by the undergraduate tutors, and sometimes they will ask other teachers to teach these lectures. And there are some standard slides, which I'll provide below, but teachers would also change the slides according to their preference as well. The 3 topics which are standardized are psychopathology. So that means a kind of medical language for describing symptoms of mental illness. So yeah, what is a delusion? Different types of thought disorder. You might have heard things like flight of ideas or disorganized thinking or things like that. So it's thinking about those terms that are used in psychiatry and helping students to understand them, understand the language. And then history and mental state examination. So history taking, as we might have mentioned before, refers to the practice of understanding someone's story through a consultation. That's in essence the so it's learning to ask the right questions, gather all the relevant information. And then the mental state examination is the observations that a psychiatrist makes about a patient. So it may include elements of the history. So it may include, for instance, that the person has the psychiatrist thinks the person has a delusion because they said X, Y, Z. But it may also include observations the psychiatrist has made, for instance, noticing that someone seemed to be talking to someone who wasn't there, which we call responding to unseen stimuli. So these are the components of what's thought of as an assessment, patient assessment in psychiatry. It's a history and mental state. So students are taught that. And then there's also a lecture looking at the Mental Health Act and the most important, the kind of main powers under the Mental Health Act, especially those relevant to people under section in acute psychiatric hospitals, which is where most students will spend some time. So the sim sessions are half-day sessions where students, again, are part of acting the part of doctors in scenarios. So we've mentioned this kind of style of learning, kind of acted learning in the context of an OSCE and also in the context of this clinical skills session. But what's different in sim is that the level of kind of acting and pretending and the level of how the environment is we try to make the environment real is a bit higher. So in a sim session, there won't just be someone playing the patient, but there might be someone playing, typically a nurse, maybe playing a more senior doctor on the phone, maybe playing a doctor in the medical hospital who the student may have to act out calling and speaking to and practicing the kind of all of the relevant communication skills that they might have to use in that that scenario was real. And as you can see from the topics below, there's a focus on medical problems that might occur on psychiatric wards. And the idea is that students have a little bit of an opportunity to rehearse what might be a quite scary situation in some cases where they might have to act fast. They'll have an opportunity to rehearse the calling the right people, initiating the appropriate treatment, communicating effectively with the patient or with a nurse if they are. And to the extent of my knowledge, it's teaching faculty that act these roles rather than employing actors for most of where the sim sessions are run in most areas. So the mock OSCE is what it says on the tin. It's a mock exam. In the real, students will go into multiple stations, about 7 to 10 stations, I think, in the mock OSCE, and each kind of what's called a station will be in a different room. When they walk into the room, there'll be an actor playing the part of patient. There'll be an examiner who doesn't say anything really and just takes notes, follows the mark scheme to mark the student, and there will be a task. Sometimes it's kind of a piece of paper stuck on the door with please take a history and recommend a management plan or do a risk assessment or something like that. And a bit of a difference from the mock OSCE to like the sim and the clinical skills is that in the sim and clinical skills, students have a lot of time because it's meant to represent a real world scenario a bit more. But the mock OSCE is a mock of the exam, so students have the time that they would have in the actual exam, which is about 7 or 9 minutes for each station, so it's really time pressured. Okay, so that's been an overview of the teaching that we provide on the psychiatry course at the moment. I'll try to link to as many documents giving further information as I can, but if I've missed anything or if there's anything that's unclear, please feel free to get in touch.